question is often asked, why should one take aspirin for heart health? I think you really have to look at who you are and where you stand. If you're an individual who's already had an MI or who's already had a stroke, clearly aspirin will prevent further strokes, further myocardial infarctions, further vascular disease.
People should take aspirin for heart health because it makes the blood thinner, and if they have a heart attack or a stroke, then they will not develop clots.
Most of the time, the reasons to have a heart attack is because your blood becomes too thick, the platelets get clumped up, cholesterol starts jumping on it, and the heart blood vessels get blocked. So when you take aspirin, it prevents the platelets to get clumped together and prevents the blood from clotting in the blood vessels of your heart.
From 81 milligrams per day to 325 milligrams a day. 81 is what we call a baby aspirin, and 325 is a single adult aspirin. So some doctors prescribe 81 milligrams a day, and then others will go up to 162 or 325.
Is aspirin right for everyone? And the answer is no. Aspirin can cause bleeding. There's no question about it that aspirin itself can damage the lining of your stomach, damage the lining of your intestine. So you have to look at your risk factors. If you had a previous history of ulcer, if you have a strong history of smoking and alcohol use, one has to be very careful about taking aspirin.
The main issue is that it can cause some irritation in the stomach lining. So it's really important to consult with your own personal doctor about taking an aspirin.
Find out if you, as an individual, stand to gain more from taking an aspirin, and you stand to have less risks when you take an aspirin for primary prevention.
And we always look at the risk-benefit ratio. If you're at a high risk for vascular disease, low risk for toxicity from aspirin, one should be taking primary aspirin to prevent vascular disease. On the other hand, if you have a history of ulcers, you have mild hypertension, mild elevated lipids, no sense in going ahead and taking aspirin and putting yourself at risk.
Take the pledge.
Take the pledge.
Take the pledge.
Take the MedStar Health Million Hearts Pledge.